Again, thank you to everybody that's joined us so far for this webinar on a unique strategy for improving the health and safety of farmers and their families. Our presenter today is Dr. Deborah Reed from the University of Kentucky. My name is Paul Jones, and I'm the manager of the National AgrAbility Project, which is headquartered at Purdue University. Some of you may not be familiar with AgrAbility. Our program is sponsored by the USDA, and we focus on issues of disability in agriculture. Every AgrAbility project is a partnership between a land-grant university and at least one nonprofit disability services organization. And currently there are 20 state projects around the country. Again, the National AgrAbility Project is led by Purdue University's Breaking New Ground Resource Center, and our partners on that grant include Goodwill of the Finger Lakes, the Osteoarthritis Action Alliance, Colorado State University, and Washington State University. If you'd like to know if your state has an AgrAbility project, you can go to agrability.org, and there's also a wealth of other information on that website related to disability in agriculture, including other archived webinars, more than 90 of those. At this point, I'm going to turn things over to Dr. Reed. For those that are not familiar with Dr. Reed, she is no stranger to ag safety and AgrAbility. She's been working in this area for about 30 years or so, and she holds professorships in the University of Kentucky College of Agriculture, Food, and Environment as an extension specialist, and also in the University of Kentucky College of Nursing. You may know her as the Ag Nurse, as many of us do. So we appreciate Dr. Reed's lengthy efforts in this area, and we look forward to hearing from her today. So I'll turn it over to her now. And you're muted right now, Dr. Reed.
Okay, here we go. So I like the way you put that, a lengthy career. Yeah, that was a kind way of saying 30 years or so. So I appreciate the opportunity to be here with the National AgrAbility Project today and come into the confines of my very empty College of Nursing building. COVID has taken a toll on all of us. It's also taken a toll on our theater that we've been wanting to do. It was such a successful launch to this project, and we're kind of chomping at the bit to get back and do more of this. But we have used it quite a bit across at least the eastern half and a little bit in the Midwest of the United States. So I'm delighted that you're here with me. Some of you may have witnessed the theater. Some of you may have been involved or heard other presentations. But I'm just going to bring you up to speed on what we're doing right now and how that has come about, because we've got some wonderful sponsors these days. The original research was funded by CDC NIOSH through one of their R01 mechanisms. Was funded for 5 years. We did theaters for about 2.5 of those years. The rest is planning and analysis, of course. But we got such good results, which I will share with you in a moment, that the Hillman Foundation, of all places, New York City, reached out to me and said, we would like to give you about an 18-month follow-up funding period so you can train other people to do the theater in their communities and maybe even go beyond agriculture. And I said, well, let's go for it. So I'm very appreciative to them. Who knew that New York City would know anything about a farm dinner theater? But the people there are just so excited about this, and I kind of thought a little bit, but they said, no, you can't retire yet, so hence a little more gray hair is going to be among the few remaining dark ones up there, I'm sure. The objective of the Farm Dinner Theater is really to influence farmers to make behavior changes that will improve the health of themselves and their families, and I could extend that and say, and any workers on the farm, and of course to prevent injuries to themselves and others, because we know that above all, farmers are always getting injured, and my own brother just had another injury not too long ago. So it's a recurring theme. I tell them all I have great job security. I'd like to work myself out of that job. But also we have to look at the families. So we know that 95% of our farms in the U.S. are family-owned and operated. I'm a big advocate of that. And we know that all of them are exposed to different things in the workplace by virtue of just living there. So what we hope to do through this project was to not just influence the farmer, but to influence the entire family unit to make behavior changes that would help their health and their safety. And to let you know how this came about, because I don't want you to think that we just sat there one day and said, oh, we're going to do theaters. This really is the end product of several years of research with farmers. And these are just 3 of the publications that we have that laid that foundation for what we in nursing call evidence-based practice. Because who wants to commit money and resources and time to producing something if it doesn't make any difference? So we did quite a bit of qualitative work across the nation, talking to particularly older farmers and their adult household members about how they saw themselves in farming and what would make them change these risky behaviors that they all know they take. We also did a survey of a cohort of farm couples across Kentucky and South Carolina, which is farm elders define health as the ability to work. So we found out very quickly that these farmers, even at advanced ages, don't really look forward to retirement. Many of them did not plan to retire at all. And they did say that they would, as they put it, cut back on their hours. I think that meant going from 60 to 40. But what we also learned is they said if we can't work, that means we're not healthy. That was the key mark for them as to health. So we knew that we were onto something, but we really didn't know what to do with this information. That last publication down there is a report on the pilot theater that we had, just 30 people. We put it together very quickly, but we used the data and the information that we had in those first 2 publications there from those 2 other studies to really inform the way we wanted to present the theater. And we actually tried the theater in different formats. Some was a little more sophisticated than others. And then we had that group to tell us what about those different formats they liked and didn't like. So what you're going to see today is the culmination of that. So what we have envisioned and what we do with the theater now is really based on what the farmers said they liked and what they would pay attention to. So we know if they don't pay attention to it, it will result in no change. What they really told us they wanted was stories, their own stories, and they wanted a lot of humor. Now, sometimes the stories that they thought were funny, I didn't think were too funny, but farmers have their own brand of humor here, so we use that a lot in our theaters. So they want actual farm stories. So that's what we took. Farmers are great storytellers. And what we did was we took different stories from those farmers and we tried to reweave those for research purposes so that we would have like 11 different themes throughout our theater. I'll explain that a little bit more as we go along because remember, this is research-based, so we had to be able to test that. So we actually wove together farm stories, but then we allowed the farmers, who are the actors in this, to interject their own stories or to reinvent those stories a little bit so that it is totally realistic to that local community. So farmers in the community serve as the actors. They don't get any pay for it. They get a lot of laughs. And what we found were that the leading farmers in the community are the ones that wanted on stage, which I found a little amazing at times. Some of these crusty old farmers that wanted to be on stage I thought were just kidding me, but no, they wanted to be up there, and you'll get to see that in a few minutes. So these health and safety messages that are woven throughout these scripts of real stories are delivered in this non-threatening way. Some of the farmers call it a date night, and I'm glad they do. But it was really interesting what they told us in some feedback. And they said it was your story, but it really wasn't. It was a third-person reality show. And that it gave them permission to talk about things that they normally wouldn't talk about with each other or with their families. All right, let's back up here. What are we talking about when we're talking about this big didactic reader theater? Well, that sounds pretty ominous and overwhelming, doesn't it? But let me assure you, all this means is that the actors on that stage don't have to memorize anything. So right away, that level of angst and emotions begins to dissipate. They go, okay, if I don't have to memorize it, if I can have a script in my hand to refer to, I'll be okay. And the focus, though, is on the words of that script rather than elaborate sets or costumes or things like that. They don't have to do a lot of action work in this. They basically can sit around a card table. And a lot of times that's what they do. What we found is it makes no difference in that community if it's a really fancy set, which we did have some communities elect to do that, or if it's just the card table and 4 chairs. The results are the same because the focus is on the words and the storylines, not on all of the, what I call the fluff to it. But some of the communities said, we want to make this a spectacular event that our communities will talk about forever, and they have. And so really you're going to hear me talk a lot about what the communities wanted because this is a true partnership. Even in the research phase of it, it was a true partnership. And now that we're moving the theater out to community total ownership, we're excited to see that similar results can take place even when those of us that have invented this thing are out of the picture. Okay, so I said didactic. That means a discussion, right? So this is sort of didactic, except right now it's just kind of one way. But we have 3 short scripts for this theater tonight. And between each one of those, there's a short discussion. I led those in the research phase. In the communities now, community leaders are leading those discussions of what themes are in that particular skit and how does the audience respond to that and what have been their experiences. So they get a sharing time, if you will. And it allows that audience to reflect back on their own life and relate it to the content they saw, and it sort of incorporates that into their lived experience. Now, that's a lot of philosophical talk, though, but it's just like, that's happened to me. So if it happened to Joe up there on the stage and that happened to me, what's a better way that I could make a different outcome for that? Now, theater, the didactic theater has been used to address several other health topics, so I don't want to say that we claim ownership to this and this is totally original. You know, there's nothing new under the sun. We just reworked it. But in the past, I know it's been used for smoking cessation, obesity, bullying. A lot of places use reader's theater. A lot of places use didactic. But it had never been used with an agricultural population. And this is why I thought this would resonate with them. Something a little bit different. Is it effective? You better believe it's effective. It's effective in so many ways. We enrolled almost 1,000 people over the term of this. We had 2 arms to this study, the theater and the comparison group. You can see the numbers there in that table. And we had 2 different survey times that they actually got a phone call. They had to answer about 20 minutes worth of questions about the theater. What did you like about it? What did you not like? What are the topics you remember? What did you do about those? A whole myriad of things. 96% of those people stayed in that study until the bitter end. It took the survey researchers down at the Capstone Poll in Alabama many tries to get that 96%, but we think we might have a record of retention. So I think it's a reflection not just of the surveyors, but they were awesome, but it's a reflection of how much the respondents, the participants enjoyed that play and how much it meant to them. You can see with our theater, within 2 weeks, 52% of them had made changes compared to, I'll tell you about the comparison group. They received a packet of written information through the mail on the same topics that were the main topics in the research arm, the intervention arm. Now, farmers had already told us prior to this that they really didn't want to get written information on anything, and it was a little bit difficult to recruit them to even take a packet, but we finally got that many. But they stayed in the study once they were in there. So everybody made changes, but the folks in the theater arm of it made more changes, and they made them more quickly than the comparison group. So even if there wasn't this significant level that you see out on the right at that 2-month time, we feel the theater is a good way to reach large groups of people at the same time and to generate those conversations where you really can't do that when you mail packets out to people. You really don't know if they take them home and throw them in the trash or not. We also asked them if they thought about any changes, because sometimes, you know, in the thought process, you have to contemplate that. Sometimes you have to get a loan, or you have to book your vacation, or what about. So they'd begun thinking about or contemplating making changes, maybe not acting on them right then. But you can see that, again, it really triggered conversations and thoughts. And we have a bunch of data to be mined from this. We also looked at dissemination within the community about how much they spread. They talked about what they learned at the theater. That was pretty interesting, too. But we don't have time to go into all of that today, so we won't. So straight from the people, because I always like to go back to the voice of the people and what they said. And this is what they said. We thought, you know, the dinner theater helped me realize we're not alone. Don't you feel disenfranchised when you think you're all alone dealing with maybe dad's Alzheimer's disease while you're trying to be out there farming? Or how is the farm going to morph into the next generation? Or the hearing loss problem, things like that. One wife who did not live on the farm with her husband, matter of fact, she didn't even know where that farm was located. She said everything they, meaning the actors, said was right on target. My husband's at the point where he needs to stop doing some of these things. This gave us a way to talk. And I was very touched when she said she feels like we were just God sent. So this opened up that hard conversation for them so that, you know, he could make some changes and she would feel that he was safer out on that farm. And again, it wasn't your story, but it was. Messages were delivered in a non-threatening way. It allowed you to get involved, and people did get involved in these discussions. Some people, particularly the spouses, said, I didn't think we had as many incidents on the farm, but listening, I realized we do. And the one I like back from the FCS agent, because we did these through extension, and the agents got to work with each other, which for sometimes for them was a first-time thing for an event. But the feedback, she said, we've never had such positive feedback from any other program. As a matter of fact, every community who had a theater clamored for another theater within the year, and the agents actually had to say, hey, you know, we need to take a break from this, but they've all planned, or a few of them have already had repeat theaters. So this is something that can be sustainable over time, a special event for the community. They liked the fact that it was very entertaining. It was a community event, and we invited, because it's a research, we had to kind of be very restrictive on who came to this, so they had to get a reservation ahead of time. Our community theaters don't necessarily have to do that now, but we did, so we could tell them about the research and get that informed consent. But we also asked couples to come so that it would be more of a social event, a night out, the date night, like they called it, and so that when they started home in that car, they could have those conversations about what happened in there and what their neighbors had said while they were on their way home. So it wasn't just the fact that we were being real magnanimous about it. We had an ulterior motive to get that couple in there so that both of them heard the same message at the same time. They liked the fact that people talked about things that they generally didn't talk about. They liked the realism, and we actually had a realism scale that they rated us on as we went through the night. They fed us a good meal. Actually, the community was responsible, the community leaders, the extension folks, were responsible for getting that meal there. We paid for it out of our grant money. But since we've morphed over to community theaters, they still serve the meal. It's not an issue because so many of the extension meetings do have a meal with it. So this is not unusual for them. They sort of expect it. They also like the fact that we didn't stick to one topic or anything. We covered a lot of things in these. And that the fact that their friends were up on that stage. Matter of fact, I think a lot of them came just because their fellow farmers were up on that stage and they thought, we've got to see this. So before the theater, the community arm of it, the extension folks, would put together a flyer. They did radio announcements. They registered the people who wanted to come so we could send them their tickets to the theater. It really was a special event for everyone. And one of the things they put on the flyer is, come see your friends on stage. This will be hilarious, which I found a little frightening, but at every one of them, there were hilarious points. So I guess they were right. So what do I mean when they made changes? Is this just a little bit of stuff like, I'm going to be more careful? No, this was very significant. They talked about attending to their medications better, eating better, getting more exercise, and improving sleep. Did these sound like exciting things just for public health, let alone for farms? So everything we did in this pertained to more than just what happened right on that farm. But they also looked at a lot of protective mechanisms that they all know about, but through these stories they understood that they should wear that hearing protection and eye protection and foot protection, all of those kind of things. We really pushed the wearing of wide-brimmed hats in a couple of the skits, and so they did that. Hydrating in the summer and the winter. Taking breaks and not working alone, just slowing down. And remember, our theaters were geared toward older farmers, so it's so important that they attend to that fatigue factor. And, you know, they found out it was okay to take naps because they found out at the theater that, gee, pretty much everybody was taking naps, but nobody was talking about it. So at the theater, the cat got out of the bag, and they talked about that. Even changing cell phone service so that they had better reception over their entire farm. Communication plans is so important if something does happen on the farm. They did a lot with their equipment. Some of them bought a fall harness. They had never heard of such a thing, so they thought that was a really good idea. That was presented in one of the plays that we had. Repairing the safety shields, even buying a new tractor with a canopy or a cab, and I was blown away by that because that is a major outlay of money. But in one of the scripts, we talked about, you know, how that's even more important as you age. So if they had been thinking about it, they went to the bank, got that loan, and they bought that new tractor. They decided to invest in themselves, which we should all do. They cleaned up a lot of the facilities that they had, good environmental hygiene, just a lot of things like that. Some of them signed up for the programs where they had a cost share to get new cattle handling facilities. A lot of our farmers were beef cattle farmers, so this was very helpful to them. But we tried to give as much during the research phase over to community ownership as we could, number one, because they were our true partners and they know their communities, but number two, we were planning for this future time when communities would actually take over the entire theater. So we needed to learn from them, and they were they were wonderful teachers. This little photo at the top here is all of the agents, extension agents from 3 counties who came together to have a theater. It's one of our larger theaters, maybe in the largest, as a matter of fact. These 3 counties had never worked together before on a program. So they were they thought this was the most wonderful thing. And it began, after the theater, they began to have other programs together. So one of the outgrowths of the theater isn't just the theater itself, but also those partnerships they begin to build with your comrades, and in this case through extension, but maybe it might be extension and public health and a school system. Who knows what it might be? Any farm safety organizations. Excuse me. So one of the things that the local partners did, of course, they had to identify who those actors were going to be because I didn't know who they could possibly be. So they all recruited their own actors, and they promoted that event, as I said. They selected the food vendor, where it was going to be, and it was entirely up to them what kind of set they wanted to have. Now, down here is one of our, I guess this is the fanciest set that we had, because you can see they got some of the local people involved, and furniture company there brought over loaned all this furniture for them to have this set, and Tractor Supply had something for one of our scenes had to do with a farm auction. So everybody got involved. So it became a real community effort, and so everyone learned from each other. So in conclusion for this part of it, I would say that, you know, this format's really effective. As you can see, you can easily adapt it to whatever local issues you're having, be it in or out of agriculture. One of the things that we did, and Eileen Legault, I don't know if she's on here today or not, but she got us in at the Pick Tennessee conference a couple of years ago, and we had a lunch and learn. And at the lunch and learn, which was just a half-an-hour thing, we had one short play. It was about 15 minutes long, and it featured AgrAbility clients. So but the people in the audience who came weren't AgrAbility clients, so they got to learn about AgrAbility during that time. They saw farmers that had to go the extra mile to be successful, how they did that, how their injuries occurred, how they recovered from that, and everyone just really loved that Lunch and Learn. So you don't have to do a full-scale 2-hour dinner theater like we did for this to be effective. It's very acceptable to that farm community. We had no idea we were going to get these kind of behavior changes. And farmers have no reason to lie about this. As you all know, they're pretty blunt and honest with us. So we were just overjoyed, blown away, really, at how well this resonated. But remember, we had done that research behind it. We had listened to the people. And until you listen, you really don't know what's going to be effective. So we feel like that we probably have reached that goal of reducing injuries. We can't claim that because we didn't follow them that long. We just did that for a couple of months. But the concept of the theater has such application to so many different groups. So we're going to go on now here. And Paul, I'm going to turn that over to you. I want you to actually see a snippet of one of the skits that we did in the research phase. So this was one of our early ones. Well, I hope you all got a good laugh out of that. That was actually just our second theater that we had during the research time. And two of those people up there on that stage were leading cattle producers in East Tennessee. And you can tell that the group in the audience was just having all kinds of fun with it. So that is a typical one. It may not have been what you expected at all, because it's not a fancy theatrical production, but the farm community loves it. So we have developed a farm theater toolkit that is now available for you to download free of charge. The communities that have been using the toolkit say that they can work from that just fine. With our Hillman grant, we're supposed to be having some training for how you actually put this theater on and to go through the toolkit. And I wish we could do that again. Hopefully we'll be able to soon. But I think this is written at a very elementary level, so anybody in any community can pick this up and run with it. We talk a little bit about the concept of the theater, but it really walks you through step by step. And remember, even if you're not dealing with farms, which of course we all do, but this can be used by schools. We have one public health nursing class using it right now for things with inner city kids. We have another group that wants to use it with psych mental health nurses. So all kinds of ways it can be used, but we do address a lot of the lessons that we learned along the way. So you're welcome to download that. You can either get that by contacting me and I'll send you the link at my email address there on the screen, and I'll be happy to send you that. There's a little bit of questions at the beginning because we do need to start tracking who gets that toolkit and how you plan to use it. So please don't let that scare you off. It's all free, no problems with that. And I think we've already done that. So if you can see that, that's the link to the toolkit. But I'm not going to go into that right now because we don't have enough time to walk through the whole toolkit, of course. But again, it's about 29 pages of instructional things or just informative things, not really instructions. And then we have sample skits in there that we've done. We have another video in there that you can click on to, and I think that helps with the community. So when you're recruiting people, you can show them a little short video like we just saw, and they begin to relax and say, oh, yeah, I can do that, or our community can do that. So things that you'd find helpful, PR things, an example of some of the flyers, and even the tickets. So we sent tickets to our registrants because being a research project, we had to have some way to, remind them when to come. So that was our official way to kind of get that information out to them about this is a research project. Here's your ticket. And people really thought those were real tickets. So sometimes they would lose their tickets and they would frantically call the extension office and say, we lost our ticket, can we still come? You can see how caught up these communities get in this type of event. So all kinds of good information in there for you. Be happy to share that with you by just clicking on that link. I think this might be the last slide that I have. So I've finished up, I think, about right on time. So Paul, do we have, or Ed, do we have any questions? Did I observe other readers' theater production? I had never even heard of this prior to this, so no, I did not get to observe other theater productions. I did see some online things, and I had a colleague who had done readers' theater at the White House, no less, on breast cancer, I think she said. But the type of theater that they did for their readers' theater ended up being very different than ours. We tried her style at our initial pilot, and the farmers like, oh, no, too stuffy. So we just sort of went with their comments.
Okay. Got several more. Did you pick the actors prior to the event, or were they picked out of the audience on the night of the event? We had a couple of questions similar to that, as others is similar to that as well.
Yeah, I saw those. No, this was not The Price is Right. We did not pick them out of the audience. It was up to, we had a planning session. We actually had a couple of planning sessions with our local partners, wherever we were going to do the theater. And I gave them sort of an outline. Our actors need to be able to read.
No, there was a few more that I didn't get.
And project really well. And they had to not mind being up on stage, of course. So the extension folks really helped out, and the planning committees in some cases helped choose those actors. They were given their scripts about at least 2 weeks beforehand. And the way I did the scripts was I took what I call skeleton scripts for the research. Remember, we had to use basically the same stories all the way through because we were gathering all of that data. But each time that they identified our 4 actors, then I talked with them on the phone and asked them about their farming and, their family members, local stories, things like that. So I rewove those original scripts to fit that farm family unit and that locale. Some of the actors were really, really good about, they had a little bit of instruction. They're supposed to read it until they almost had it memorized. Had a few actors who didn't open that packet till the night before. We actually had the play, which scared the dickens out of me. But it was amazing how the other 3 actors would take that person outside, and by the time they came back in, they were doing really well. I don't know what they did to them. We only had 1 rehearsal with our actors. And this is a caution. You can over-rehearse, and then what happens up on stage is the actors don't have that spontaneity about them. So we found that just 1 rehearsal, about 2 or 3 nights before the theater, was absolutely ideal. We could make little changes, but it relaxed them, and they didn't overread.
Excellent. This is a comment or a compliment. Hope this is awesome. Hope we can replicate it.
It can be replicated, too, and it has been. As a matter of fact, John McNamara over in Ireland took the idea. I did not know that he was doing this till after he did it. And he had a modified theater with the dairymen in Ireland, and they absolutely loved it. So he sent me a little write-up that appeared in their magazine, and I was a little upset because I didn't get to go to Ireland and see it.
Okay. Target audience, just elderly farmers?
Absolutely not.
Great.
Remember, this was based on research, so the research had to be very focused, and the senior farmers are the ones more likely to be, well, not more likely to be injured, but more likely to die from an injury. So to sell this to NIOSH, we targeted older farmers. It was supposed to be 55 and older. The communities begged us to lower that, so we got permission to go to 45. And at the end of our research, we piloted this with young farmers, and the effects are identical with it. So it can be anyone, any age.
Great, great. Do you deal with mental or just mental health issues, or strictly physical health issues?
No, both. But remember the time frame when we did this, 2015, 16, 17. We didn't have the big public awareness about mental health that we have now. So now we're beginning to actually use those words out in public. But the farmers then, they weren't. So we dealt with stress issues, like never getting off the farm and taking a vacation, dealing with Dad with Alzheimer's, taking Dad's tractor keys, and the fact that fatigue wears you down and how that's related to stress and physical outcomes. So we wove it in there, but we didn't address all of the things that we're addressing now. I'm glad to see that we're we're really talking about this publicly now.
Okay. Okay.
Yeah.
I think I answered this one before. Everybody used a similar script with some.
Yeah, similar, but not the same, identical scripts. But you can look at each one of the scripts for each site, and we had 8 sites. You can lay those side by side and realize that they're a little different, but the themes are all in there. We did add a few themes. We had a place in Tennessee that was worried about sinkholes, and so we wrote that into the script. We had another place that was worried about explosives on the farm, so we wove that in there too. But our main thing is the same.
Okay.
Well, that's a good one.
There you go.
Well, maybe as effective as what we're being today. We're thinking about this, and I would say I think it can be. Maybe not as effective, but it can be effective. So if you could put together, you know, the folks that are going to be acting and maybe do that together, you could maybe post it and have comments or, you know, be a chat room or something like that. We just have to really think out of the box these days.
That's for sure. Did you notice that some of the actors and sites were more effective than others? I think you've already maybe addressed this a little bit too.
Yeah, overall, no. We've done, my colleague Deborah McCallum in Alabama has really looked at this data every which way that she can, individual versus farm unit and all. And when we look at it by site, there is no difference. So like I said, a card table and 4 chairs, just as effective as a fancy set, as a steak dinner, and all the tablecloths that they had at another site. Which is nice, because that means that you're not limited by budget.
Absolutely. Has anyone used this with migrant workers?
Actually, the only thing I have found was years ago, Dr. Pam Elkind out in Washington State, and her article was the first one I'd read about using theater with farmers, other than what the New York folks did several years ago, and theirs did address mental health, but I believe at that time they used a professional theater troupe, which, of course, we couldn't do. But Pam did that with migrant workers, and they seemed to like it and everything, but there was no follow-up to it like we had the good fortune to do. But I think it very much lends itself to anyone who learns via an oral tradition. So that'd be great. Okay. I'd love to hear about it.
Great. What time of year were your theaters hosted?
When farmers can't do anything else. So that basically meant for us, we did these in Kentucky and Tennessee and one in Virginia. We did them in the winter, basically January and February, which didn't make it easy on those of us who had to be on the road to get there. But that's the time the farmers can really come out and, you know, participate.
Well, that's the classic extension program time of year.
It is.
Okay. You mentioned this. How long did the actors have beforehand to prepare?
Yeah, they had them a couple of weeks. Some of them looked at it a couple of weeks. Some of them looked at it the week before. One of them didn't look at it at all until that night.
Sure. I understand that. Okay. You're not out of the woods yet. We've got other questions that came in after
oh.
If I can, let's see.
Can you speak about the audience discussion after the theater performance? I've got that one here from Mary. Yeah, I'm sorry, I left that totally out. So I had some notes, and they're available in the toolkit for people to kind of have a little crib sheet to go by. It's about a 5-minute discussion, and it really depends on the audience. Some audiences really like to talk a lot, but I would say, what just happened up here on this stage? Tell me about a time that one of you might have had something similar on your farm or in your family. And that sort of opened it up. I found that the younger group didn't want to talk to me. It could have been the gray hair, or it could have been that they just react different. I don't know. But in those cases, I just present a few little anecdotes that I had at hand, or a few little smattering of statistics. When we did this, when I mentioned the farmer suicide prevalence, these folks had no idea that was part of it. Well, I didn't want to put that in the script, but I wanted them to know it. So you can kind of pepper back a little bit. But 5 minutes is about all you want for discussion. They're ready to move on and see what's going to happen next. Let's see.
Okay.
Let's see the others.
Yeah, I'm back now. What were the usual size of the audiences at your events?
Well, that's a good one too. Our first event got clobbered by some natural things that happened in the community, so I think we only had about 35 in that one. We had wanted 50 to 70 for each site, but it was so popular that at some sites we capped it at 100 and had a wait list. And
oh, wow.
Yeah, I mean, they're overwhelmingly popular. Here's my caution to it. If you get 100 people in that room, you will not have as lively a discussion because, like anything else, 2 or 3 people will talk, and the rest of them in a crowd that size will not talk. That's okay. We still got the same results. It just depends on how much interaction you really want. But it does take a lot of work, and to get one of these ready. So you don't want to do it for 10 people naturally.
Sure, absolutely. Yeah. Length of the sessions, each one.
Each one of our little skits, as I call them, is between 10 and 15 minutes. That's about as long as that audience is going to sit there. And we have dinner ahead of time, so the tables are cleared and everything, but they're still at those tables. We found that's about enough, and we crammed it with so much information, I don't think we could do longer than that. It's better to break it down and small. Ours was like, the first one is a conversation at McDonald's or Hardee's or wherever the local hangout is for farmers in your community. The second one, the setting was supposed to be an extension meeting, and the third one was a farm auction, and the farm was going up for sale, and so was the equipment. And it was after those same 4 farmers had aged like 15 to 20 years. So they're walking in with a cane, and they can't hear, and all that kind of stuff. So that's the way we did it.
Okay. Let's see. We've talked about virtually. Request to put the link to the toolkit in the chat box, and I see that down the way a little ways, so that's taken care of.
I see one that I want to address from James up in New York. Hey, Jim, good to see you. Do you think the scripts and materials would work with an old order Mennonite community? I'm not that aware of all the culture of the Mennonites, and I know there's different sects of the Mennonites, but I would think it would. Dr. Susan Jones here in Kentucky works extensively with Mennonites, and we've talked about this, trying it in Kentucky. So I would love to know if they would be receptive to something like this. And you're just the person to do it, Jim. And I see one from Richard down there. Now, Richard was asking, what was he asking? Where did it go? I've been up to Maine, and I'm ready. You've got that toolkit, so I'm looking forward to you using it. Do you think the use of puppets might be useful? Oh, that's a great idea. If you wanted to talk with kids, of course, you can have puppet shows all the time. But, yeah, that's a variation of it I hadn't even thought about. Great idea. Let's see. You see any, Ed, that I don't see?
Down toward the bottom, this is a great way to teach. What's next for this project? Will there be further research projects to follow up with this one?
Well, if we get delivered from COVID before June the 30th or next December the 30th, because the Hillman Foundation's going to grant us an extension, we would love to see some of the people that we're training to have their own theaters, because I'm not going to be doing this anymore. I'm getting ready to really retire, folks. This is not my program. It belongs to the people. It was developed with federal funds, and I would love to see any and all use it. I am encouraging people like Jim, if you wanted to try it with the Mennonites, I think it would be a wonderful project to do through one of the ag centers or through some other mechanism. There is funding for this type of thing through the arts programs in your local communities or in your state community, too. Humana Healthcare is really advocating the use of theater as a medium for advancing health. So, like I said, it's a time for us to stay in our boxes, but think out of the box.
Sure. Let's see, this kind of follows up on the COVID issue and more of a statement. We'll need to consider adapting due to the impacts of COVID-19 on audience size and even serving food. It's going to take creativity which I think we're all experiencing with our programming at this time.
And that will be different for different states, of course. In Kentucky, we're opening up some, but not hugely right now. And I want us to all be safe because that's the whole intent of the theater in the first place.
I think.
One of the things I'd like to do is, this was a teaser for you in AgrAbility. So if you guys would like a more formal training on the toolkit, we can certainly work with the National AgrAbility Project, or perhaps something will open up at some time that we could have. It takes about an hour, really, for me to lead you, or one of my other team members to lead you through the training. Dr. Robin Tudor Markham has been through this, and she is fully capable of leading it. Dr. Cheryl Witt has here. Ellen Dyson out in Nebraska has been through this. So we're beginning to ratchet up a little bit.
Great. I think that's most of the questions without getting into some duplicates. So I think I'll pass it back over to Paul.
Well, thanks again, Dr. Reed, for the excellent presentation. We're going to have a write-in campaign, I think, to persuade the University of Kentucky to not let you retire yet, though. So I may be organizing that here pretty soon. Thanks also to everybody that participated today, joined in. If you've got more questions, feel free to send them to me, and I can pass them on to Dr. Reed. Remember, we're having another webinar in about 2 weeks, so you'll get information on that if you have not already. And I think that ends our presentation for the day. So thank you very much, and have a good rest of your day.
Everyone stay safe. Thanks for joining us.